So now to carry on with the previous lecture, we're going to look again at the structure of the skull and the brain within the skull, and we're going to do a survey of the cerebrum. I've often used the term cortex to describe the cerebrum, but it's synonymous. So the cerebrum refers to the region of the brain that includes the cortex, and we're going to, in this case, look at a slide that we just finished with. Just to recap on a couple of things, the cranium is the area inside the skull, and you can see that not just the cortex but also the cerebellum is located here, and together those two come to be called the brain for this particular purpose. So I'm going to use that word throughout the lecture. You see the cerebrum is differentiated from the cerebellum here. You've got also in this image some examples of the protective layer of the brain, which is the meninges, and we looked at these in the previous lecture. The meninges is a collective noun for the dura mater, the arachnoid layer, the subarachnoid space, including cerebrospinal fluid, and the pia mater. And we saw how these different layers are keeping the cortex protected from any damage to the skull or to the blood supply that may affect the way the cortex is functioning. Now, within the skull, there are a number of key features that we need to explain. There are three broad sections of the skull. This image of the skull is showing the anterior at this end and the posterior at this end, but we're looking down into the skull from the top of the head. So we're now looking at the inferior view of the skull, that is the image of the base of the skull. And we can see that at the front we've got the frontal bone, where the frontal lobe would sit inside the frontal bone and above the frontal bone. The temporal lobe would sit above the temporal bone, and the occipital lobe would sit above the occipital bone. So each of these structures are nestling the brain structure within them, like a cradle. Now, the key features of the structure of the skull that may help you to understand the formation of these bones are, first of all, the foramen magnum, which is a direct connection to the spinal cord. So within here the midbrain would sit, and from there directly descend to the spinal cord. So this hole actually connects the spinal cord, midbrain, and cortex, cerebrum. So if you like, this is transmission hub for the regions of the basal ganglia, the diencephalon, and so forth, such as the thalamus, which sit above this hole and pass information directly down to the spinal cord. And similarly, information from the spinal cord passes up to the cortex through the foramen magnum. Each of these other foramens, like the jugular, the optic, these are all indicative of the way that the arterial supply, the blood supply, makes contact with the meninges around the protective surface of the cerebrum. So the jugular is an artery that comes from the neck. There's one on the left, there's one on the right. The jugular jugular artery provides blood supply directly to each side of the brain via this opening, so that the artery would slip through this opening. The same thing is true of the optic foramen. There are some holes here, you can see. The optic chiasm fits quite neatly into this structure here. So if you remember, the optic chiasm brings the optic nerve together and then decussates at this particular junction. We also, let me see, have the carotid. So this is a canal, which is, again, space where an artery can enter, supply blood, meninges, and I think those are the only critical features. So the key point about the bone structure of the skull is that the brain is sitting above rather a rough and sometimes quite hostile surface, and if the brain is moving within the skull, which it can do because it's bathed in cerebrospinal fluid, then sometimes we can get tears in the base of the skull that will create some difficulties for the blood flow in the brain, and more of that in a little while.